the senator will be informed.
I've listened the last few weeks on the floor to many of my colleagues on both sides of the aisle. I happen to be one of two physicians in the Senate, and I still practice. I saw 11 patients Monday morning in an office in Muskogee, Oklahoma. Saw some sick kids, saw some women, some senior citizens, saw people having difficulties with pregnancies. And I'm kind of struck as I've watched and listened to where we are in the country today. We have a lot of problems in front of us. The financial problems, our unemployment problems, the fact that we need to get our economy up and going. But I saw something that my staff had sent me that really explained and gave a great big huge answer to me. It became crystal clear. There was a guy holding a poster. And I've added a few things to his poster, but in essence, here's what it said. On the top line, he said, Medicare's broke. That's true. We all know that. It runs a negative cash balance, total negative cash balance, starting in 2017, probably 2014. So 5 years from now, we're going to be dipping. The vast majority of the funds for Medicare are not going to come from Medicare taxes. They're going to come from the citizens of this country through the regular taxes, or we're going to borrow it from our kids. The states are broke because we got Medicare on them, Medicaid on them. They're all struggling mightily right now. So Medicaid's broke. Now, what else is broke? The post office is broke. We know that. We just gave them $2 billion to get them out of their cash flow, but they're going to run about an $8 billion, $10 billion deficit next year. The census is broke. We know that. It's going to cost 2.5 times what it cost the last time, and we're not even sure we're going to get an accurate census. The Highway Trust Fund is broke. We're getting ready to have a bill on the floor here in the very next few days or weeks that will extend the life of the Highway Trust Fund, but it's going to take $248 billion from our grandkids and with a wink and a nod and say it's not broke. It's not any different than what we were trying to do on the Medicare doctor fix, on the reimbursement fix. So the Highway Trust Fund's broke. Fannie Mae's broke. Freddie Mac's broke. Medicare's broke. Medicaid's broke. The country's broke. And here in the midst of all of this, we're getting ready to add a $1 trillion program run by the very same individuals that have got Medicare broken, Medicaid broken, Highway Trust Fund broken, Post Office broken, Census broken, Fannie Mae broken, Freddie Mac broken, and we're supposed to trust us to design a system to fix the problem. Now, there's no question there are some problems in healthcare. The biggest problem is it costs too much. I see that every day when I practice medicine. And I've seen it for 25 years. It's exacerbated now. Most people won't agree with my assessment, but one of the reasons that the costs are so high isn't just technology, and certainly isn't in the insurance industry. It's the demands we've placed on the system through Medicare and Medicaid. I get to see that and experience that every day. The added costs that go into the healthcare system because I have to do something the way Medicare wants me to do it, not the way I would do it normally with my other patients. I have to make sure I cross the T's and dot the I's for Medicare. It's ironic that right now, as we're sitting here, there is a hearing going on strategies to address Medicare fraud. We have a bill that's getting ready to come to the floor that doesn't have any of that in it. Why didn't we have that hearing 6 months ago when we asked for it, or a year ago when we asked for it, or 2 years ago when we did have one that I had in my subcommittee where we found out that HHS doesn't even know how much Medicaid fraud there is, and they underestimate their Medicare fraud by 50% according to the GAO, that we're almost at 20% fraud. And now we're having a hearing after a bill is written to find out new strategies for it. Why? Because there's no defense that we could ever muster or maintain against the accusation that we've allowed a system to have this kind of fraud in it. And yet we're supposed to turn around and ask the American people to trust us to fix what's wrong in healthcare. Now, there are significant things wrong in healthcare. It costs way too much. It doesn't have to cost way too much, but we've put that into the system. So we're going to, and let me for a minute defend American medicine. If you're sick anywhere in the world, the best place to get sick is in this country. We have a 30 to 50% higher cancer cure rate than anybody in the world. If you have an acute coronary syndrome, heart attack, or stroke, we have the best place in the world to have the best outcome for the best hope for you, with the best survivability. If, in fact, you have an orthopedic problem, whether it's a fractured hip, fractured leg, need a new joint, this is the best place in the world to get the best care with the least complications, with the best outcome of any place in the world. Now, there's been a lot of people that have been critical of the bad things in healthcare, and they are. They rightly so should be. But what we're about to do is to damage the very best healthcare in the world to fix what is wrong with that system. And so rather than to preserve what is good, we're going to take over. We're already at 61%, the government runs healthcare. 61% of all healthcare is run by the government today. And just add it up, whether it be military healthcare, Indian healthcare, VA healthcare, Medicaid, Medicare, S-CHIP, and federal employees healthcare, FEHPB. 61% of all healthcare is run through the government today. So you come back to say, well, how in the world could we have the cost so out of the line? Well, we have the cost out of the line because we have healthcare bills that aren't going to address the real costs. Instead of having a monstrous bill that costs $1 trillion, actually it's going to cost far more than that. It's going to cost about $2.8 trillion the full first 10 years that it's in effect. Rather than do that, we ought to fix the easy things first, like the fraud in Medicare. It's not hard to fix. We pay and chase. We've known that for years. We've tried to do something about it. We can't do anything about it. In other words, we assume when you bill Medicare that you billed them right. And then we pay you, and then if it's not, we go try to find you. Rather than have active live intervention that you have to demonstrate that you have a certified patient and did a certified procedure or a certified product. So we could save in healthcare $60 to $70 billion a year just in government programs if we fix the fraud. We could save another $100 billion a year if, in fact, we incentivized or changed the tort system in this country. Because what we know is 80% of all lawsuits are frauds in healthcare. They all get dropped. They never get paid attention to, but they get filed hoping to extort money out of our insurance companies that cover doctors. And of the remaining 20%, 89.9% of those are found in favor of the provider. So what that really says is less than 3% of all the suits that are filed are legitimate. And those poor people who win the 3%, 60% of the money doesn't go to them. It goes to the system. What else could we do? We could change the tax code so that if you're an individual, you get the same tax benefit that the corporations do when they buy their employees health insurance. No, we won't do that. We haven't done that in this bill. So if in fact you're well-to-do or your benefit of having an employer pays your health care, you get $2,700 worth of benefit a year. But if you're a single man or woman trying to raise a child and you're self-employed, you get none. You get $100 worth of tax benefit. So we totally side with those that are well-to-do in terms of the tax benefit in this country rather than help the people that are out there trying to buy individual health insurance. We could create a transparent market. We could mandate tomorrow that all insurance sold in this company, you have to put out the prices, you have to put out the quality, you have to put out your payment terms, and you have to put out the prices that you'll pay. And the same with every provider in healthcare so that you can know what you're going to get, what it's going to cost, and what the likelihood of the outcome is beforehand. Finally, we could encourage sale of insurance products across state lines to really force competition into the insurance market. There's no question they need competition. They have it inside, but it's mandated down to the state level. So the only way you'll ever create real competition and force competition in healthcare is to make them all compete against each other and give you the ability to buy what you want for your family, what you think you need, and get the care you want at a price you can afford. We're not going to do that with this plan or any of the plans that have been offered. What we're going to do is we're going to see the cost of your insurance go up, not down. And then finally, we could have group health associations where businesses that can come together across state lines and join an association and have buying power in the insurance industry. That's been blocked in this body for 4 years. So we could do 4 or 5 things. None of those would cost any money. None of that would require us to steal money from Medicare Advantage and Medicare to create a new program rather than to fund the sustainable portion of Medicare. So as we look at health care, and there's no question we have problems, and I want to see them fixed, it's important to put it into perspective. We have failed at everything we have done in terms of being effective stewards when it comes to health care programs through the federal government. They are neither efficient nor highly effective. And we're getting ready to ask the American people to trust us with another couple of $1 trillion over the next 10 years to create a new system, demonstrating the fact that we don't know how to run and won't be responsible for the systems that we have. We're going to create a new system. And the idea is just trust us. Well, our actions, the demonstrated lack of financial security of the healthcare programs today ought to give us all great caution that we somehow in the federal government know what we're doing when it comes to healthcare. The proof is that we absolutely have no idea what we're doing. That's why there's an $85 trillion unfunded liability on Medicare. That's why there's over $100 trillion in unfunded liabilities when you come to Social Security, Medicare, Medicaid, and SCHIP that we'll never be able to take care of, and we're going to shove all that off on our kids and grandkids. But just trust us, we can get it right this time. We can create 88 new programs. That's what's in this. 88 new bureaucracies, new government programs. If you think 88 new government bureaucracies with 150,000 federal employees aren't going to stand between you and your provider, you have another thought coming. They're going to write rules and regulations that are going to cripple the ability for you to make the decisions about your health care and your family. And it's going to slow your access to health care, and it's going to raise your cost of health care. There's ways to get out of this. There's ways to lower the cost. There's ways to not grow the government and make more health care available to hundreds of thousands and millions of American citizens. The first health care bill introduced was the Patient's Choice Act that was filed in this Congress by myself and Richard Burr. It saves money rather than costs money. It saves $70 billion the first 10 years, saves the state $1 trillion the first 10 years. It's the total opposite of what we got coming. It is a patient-centered plan rather than a government-centered plan. It puts patients in charge rather than government bureaucrats and senators. The last thing I want to happen to me and my patients, I'm 61 years old, it's not going to be long I'm in Medicare. The last thing I want is somebody in Washington making a decision about what I can get, my family can get, whether I can afford it or not is up to me, but what I can get and where I can get that ought to be totally and 100% left in my hands as an individual free in this country. One final point, Mr. President. In this bill is a mandate that you have to buy insurance. You have to buy insurance. Now, if you own your own home, you don't have to buy homeowners insurance. If you don't want to have general liability on your property, you don't have to do it. If you choose not to drive a car, you don't have to buy auto insurance. And by the way, 25% of the people who own a car don't buy it. They buy it and then cancel it. We know that. That was the latest statistics. So we're going to tell everybody in America You no longer have the freedom to make a choice that if you have the assets, you choose not to buy health insurance, you're going to get a fine, a misdemeanor from the federal government. We're going to take away your freedom to make a decision that you think is in your best interest. And I note that I have a limited amount of time, and with that, I just call on the American public to pay very close attention, not to what we say and are going to do in the next few weeks in Washington. Look at what we've done in the past. I don't think you can trust us with health care the way we're going. We haven't demonstrated that we can do that. The person to trust on health care is you. We can fix what's wrong without bringing another 20% of the health care into the federal government and shackling our children forever. Thank you, Mr. President, and I yield the floor.
Morning business is closed. Under the previous order, the Senate will resume consideration of the motion to proceed to H.R. 3548, which the clerk will report.